Hey everyone, and warmly welcome to this explainer on male fertility diagnosis. So, if you or your partner are exploring fertility care right now, you're probably feeling a whole mix of emotions. Maybe you're a little overwhelmed, perhaps a bit anxious, but hopefully you're also holding on to a lot of hope. Today, we're going to walk through this entire journey together. Using resources and patient guides from ART Fertility Clinics, we're going to break down exactly what male fertility diagnosis looks like. My goal here is to just be your supportive guide, We're going to demystify the medical jargon and show you exactly what to expect at every single step. We want to empower you with the knowledge so that you can walk into that clinic feeling prepared, calm, and totally ready.
Right off the bat, I want to anchor us in an incredibly powerful fact. Once the exact cause of infertility in a male is diagnosed, the chances of a successful pregnancy increase dramatically. I really want you to take a second and let that sink in. Getting a diagnosis is not a hurdle. It is absolutely not a roadblock. It's actually a vital stepping stone to growing your family. Anxiety in fertility care usually stems from feeling like you've lost control. But getting a diagnosis, that's exactly how you reclaim that control. It's literally the key that unlocks the door to the right treatments. Because when we know exactly what's going on, the medical team can create a hyper-targeted plan just for you. So seeking out a diagnosis is truly one of the most proactive, positive things you can possibly do on this journey.
Okay, let's dive into this. Part 1. Finding Answers and Hope, the Diagnostic Journey.
So, what does this actually look like? We're going to look at exactly how a fertility clinic structures your care from the very second you walk through their doors. To get the big picture, we can use this framework outlined by Dr. Fatemi from ART Fertility Clinics. It's a really clear three-step path. Step 1 is anamnesia and screening. Step 2 is the actual diagnosis, and Step 3 involves exploring treatment options. Having this kind of map is what helps eliminate all that fear of the unknown. You're not just wandering in the dark here. You are being guided on a very logical path forward. Clinics use this structure so you never have to guess what comes next, and the medical team uses it to make sure absolutely no stone is left unturned, and that your care is 100% personalized to you.
Moving right along to Part 2, your first steps in care, starting the conversation. That initial consultation is often the part that causes the most anxiety for folks. But actually, it's designed to be a safe, welcoming space for something your doctor might call anamnesis. That's the term Dr. Fatemi uses when describing the clinic's process. Now, I know that sounds like a highly technical, intimidating medical word, but let's demystify it right now. Anamnesis is simply a conversation. That's it. It's the initial gathering of a couple's medical history. It's just dedicated time for the doctor to sit down with you, listen to your story, understand your background, and learn about your health history. This chat is absolutely crucial because the details you share act like little clues. They help the doctor determine potential underlying causes, and importantly, they guide exactly which screening tests should be ordered next. It's all about tailoring the care to your specific situation, right from day one. Which brings us to Part 3, 3 key fertility tests, gathering the puzzle pieces.
And this brilliantly illustrates what happens next. Once your history is gathered, your doctor will likely recommend specific screenings to go find those missing puzzle pieces. We're going to look at 3 main evaluations today. We have post-ejaculation urinalysis, which involves testing the urine, semen analysis, which is a microscopic exam, and a testicular biopsy, which involves extracting tissue samples. Don't worry, I'm going to walk you through these medical evaluations at a nice, comfortable pace. We'll take a look at each one of these individually so you understand exactly what they are, why they're so helpful, and how these specific puzzle pieces fit into the larger picture of your diagnosis.
So, the crucial point here is understanding what each test is actually looking for, starting with the post-ejaculation urinalysis. Just as the name implies in plain language, this is a test performed on the man's urine specifically after ejaculation. The medical team is, they're essentially checking the basic mechanics first. Primarily, they're looking for clues like whether sperm is traveling backward into the bladder instead of out through the urethra. This is a condition known as retrograde ejaculation. It's a very straightforward standard procedure, but it gives the laboratory incredibly important baseline information about what is happening inside the body.
Now, what's really interesting about this slide is how deep we can look. The most well-known fertility test is the semen analysis. This is a microscopic examination, and the laboratory is looking very, very closely at 3 specific critical factors. First, the shape of the sperm. Second, the number, meaning the overall count. And third, the movement, also known as motility. By looking at these 3 elements, shape, number, and movement, the medical team can gain a profound understanding of sperm health and function. It's a highly detailed look that really provides some of the most important answers on your whole diagnostic journey.
Okay, the third test mentioned in the clinical resources is a testicular biopsy. This is a procedure where tiny tissue samples are extracted from the testicles and then sent over to a laboratory for careful evaluation. Now, I know the word biopsy can sound kind of intimidating, for sure, but I want you to reframe how you think about it. This procedure is simply a way for the lab to directly access the environment where sperm is actually produced. By looking at these tiny tissue samples, they can find the missing answers that just might not be visible in those other tests. It is just another powerful tool to help your doctor understand exactly what's going on.
Let's move to our final section and see how this all builds up. Part 4, from diagnosis to treatment, moving forward with confidence. Once all those puzzle pieces are put together and a really clear diagnosis is reached, you step into the highly hopeful phase of actual, concrete solutions. Because once the exact cause is diagnosed, this whole world of options opens up to you. As the clinic notes, fertility treatments for male conditions range incredibly widely. On one side of the spectrum, the solution might be as simple as the administration of specific drugs or medications to balance things out. On the flip side, it might involve corrective surgery designed to directly rectify the physical problem that was identified during the testing phase. But the beautiful thing here is that the treatment is completely matched to the diagnosis. You're getting exactly the right care for your specific body, which brings us right back to that dramatic increase in the chances of a successful pregnancy we talked about earlier.
Well, we've covered a lot of ground today, haven't we? From that very first conversation to the key tests and the treatment options. You've seen the map, and you know the path forward. So I want to leave you with an empowering thought. Now that you know the steps, what is one question you're going to bring to your first fertility consultation? Take a second to think about it. Maybe even write it down. Remember, you are now prepared, you are proactive, and you have the knowledge to be an active participant in your own care. Thank you so much for joining me for this explainer. I really hope it's brought you clarity, comfort, and most importantly, a whole lot of hope for the journey ahead.